Welcome, I'm Karen Kleinwert. I'm the co-creative director and founder of Therapy and Transition. We are grateful that you stopped by today for our video blog. Today we are discussing naturopathy. You can learn more about me and our company by visiting our website at www.therapyandtransition.org. So the three things we're going to discuss briefly today about naturopathy is: one, what is naturopathy in general terms? Two, we're going to go over what a typical session might be like when you visit a naturopathic doctor. And third, we're going to give you a list of resources and complementary healing sources that naturopathic doctors use or embrace when teaching your body to heal itself. So let's begin. Naturopathy. It is a form of healing where the body heals itself. The philosophy is with naturopathy that using natural or organic elements to support your body in healing itself through dis-ease. So that's the general term of what naturopathy is. Naturopathic doctors, or NDs, go through an immense amount of training and experience and practicums before writing their license and having the ability to put the letters of ND behind their name. So definitely, if they have those, you know they've done their training and have definitely earned that right. So next, what would a typical session look like to go to a naturopathic doctor? Well, I would have to say that it's actually not too different than a regular medical doctor visit. And I say that in a limited scope because the initial elements are similar. They're going to take your medical history. They're going to take your family history. They're going to take what is happening with you personally right now, what's happening with you career-wise. Generally, they're going to look at an overall picture of who you are and what makes you you. Well, the difference between naturopathic and medical doctors is the naturopathic doctor is actually going to talk to you about your spiritual health, your emotional health, and not just your physical health. They're going to talk about mental health. So they really embrace that holistic mind, body, and spirit integration into their practice when they talk to you and start working with you about having your body to heal itself. So your typical session is going to go through the regime of questions after questions after questions. The naturopathic doctor is going to want to know everything possible that you will share with them. And it's important to be honest when you're answering these questions. The next step is they're going to ask you to go through a battery of tests, similar to a medical doctor, heart rate, blood pressure. They're going to put you through the same types of blood work. And the difference comes at this point. They actually use the information that they receive from these tests a little bit differently. They are going to use them to figure out what pieces aren't fully in alignment or balanced within your body. So say your potassium is low, then they're going to look at that as one piece. They're going to look at multiple levels and say, how can they naturally support your overall well-being? And their prescription is going to include elements to help bring levels that are low up, levels that are high down, with the intention that all elements of your physical body come back into balance. And with that being in balance, then they know they can begin also dealing with the mental and the spiritual pieces and bringing all three elements working together in tandem, concurrently supporting your change and transition. So what are the complementary healing pieces that a naturopathic doctor might invoke or suggest prescribe to their patients? Well, it's going to include things like acupuncture, massage, energy work like Reiki. They might also suggest some sort of detoxification. They might suggest things like counseling or coaching to work with you regarding setting appropriate milestones and goals to keep you moving forward while you're working on the physical element. They also might include a change in your physical regime. If you don't exercise, they might ask you to start exercising and what that will look like for you. So they have a whole list of things and supportive elements that they will bring forward and have you begin working on to create that balanced lifestyle. So naturopathy is looking at your whole lifestyle, not just your physical and what might be going on there. They will also bring in the other two elements. And so that is a general overview of what naturopathy is, what your typical session might be, as well as what are some of the complementary healing sessions that they will include in their prescription. So as always, we do is we suggest you continue your current medical regime. Don't change anything until you talk to your doctor first. And no jumping ship. That's the other thing that we strongly recommend, is you work with both of them concurrently, and that it is open communication between everybody. So that is our video blog today. Thank you for stopping by. I am Karen Kleinwort, the co-creative director and founder of Therapy and Transition. You can learn more about me and our company, as well as read the text of this video blog on our website at www.therapyandtransition.org. Until next time, embrace your inner wisdom.